Today we will be talking to our poster hall panelists. I'm actually very excited to speak with you about your work. And this session is being recorded and will be shared and available to the New Jersey Psychological Association community. During the session, I will be posing questions to you, each of the posters directly. However, if there are comments that folks would like to make, please do put it in the chat box. We have some moderators online with us who will be monitoring the chat and sharing those questions with me so that I can raise it for the entire group. I think that's about it. I want to thank everyone who's on the call assisting, Alice, Jennifer, and Kara, as well as we have a student assistant, Christina. So thank you all for being on the call. And again, welcome to the poster presentation. I actually love this format. It gives us a nice opportunity to review your video presentations. It was just wonderful to see. And I'm sure it challenged you to find a succinct way to talk about your work. And I know that you spent a lot of time and energy and effort into that work. And so I do like this format. I think it's accessible to many, many more people than folks who would simply attend a poster hall. So thank you for taking the time and for doing the work. I just want to make sure that we have everyone on the call who is presenting today. So maybe you can just go around and just introduce yourselves and say the title of your poster. Why don't we start with Erica?
Hi, my name is Erica Young. I'm poster number 5. It's Juvenile Interrogation Law for Psychologists, New Jersey Case Law and Psychological Implications.
Thank you. And say what school you're from.
Sorry, I'm from Kane University, grad program.
Wonderful. Let's go with Leah.
Hi, everyone. I'm Leah. I'm from William Patterson PsyD program. And I also have Brooke, who helped along with this poster. And our poster is called The Underlying Skills Contributing to the Social Functioning of Children with Behavioral, Emotional, and Cognitive Concerns.
Okay, thank you. Hannah?
Hi, my name is Hannah. My poster is titled An Innovative Measure of Psychological Intimate Partner Violence in a National Sample of Adolescents. And I go to William Patterson with Leah.
Okay, fantastic. And is Dr. Parente on the call? I don't see her. Maybe she's having trouble connecting. We also have any other presenters that I did not call on?
Yeah, I'm not presenting this morning, but I'm presenting tomorrow. I just wanted to sit in and see how everyone else's presentations go. So best of luck, everyone, and hope to see you tomorrow.
Okay, terrific. Thank you. Okay. Well, I'm sure that I see someone is trying to connect and is having some challenges. So why don't we get started? And if Dr. Parente does connect, we will acknowledge her. So I will start with Leah and Brooke. So really thank you for your presentation. I noticed that one of the findings that you reported on was that as you know, there's a decrease in processing skills, there's an increase in social stress. And I also read in your poster that behavioral problems tend to be related to stress and affect deficits and affect problems. So this sort of cognitive deficit is balanced with interpersonal experiences. So this stress that comes from interpersonal interactions. And my question to you is, would you expect that the students that you're looking at with interpersonal behavioral problems, would you expect them to have cognitive strengths that can be engaged in managing some of the stress that they're experiencing. And as you think about that question, I just want to say that this particular session this afternoon is an organization or collection of posters that focus on the psychological concerns facing young people, children, adolescents, and young adults. The contributors all here discuss a range of psychological problems and treatment issues, including assessment, using drawing techniques, social functioning, intimate partner violence, and juvenile interrogation. Okay, so back to you, Leah.
Sure. So, not sure if I remember the entire question that you just posed, but I'll touch on parts of it that you asked. So I think you asked what types of, or so people with higher cognitive skills have, sorry, can you repeat part of the question?
Yes, absolutely. So would expect that students with interpersonal behavioral problems have cognitive strengths that can help them. So you talked about the deficits, like sort of processing speed deficits, and their challenges with those with behavioral problems being able to handle stress, affect related challenges.
Right. So
the other side of this, which you did not study, but just based on your findings, can you elaborate on whether or not you believe that there are cognitive strengths that can be used?
yes, so I think it's interesting to see that children who have higher cognitive skills they also have higher interpersonal relationships, and so within that, I think that it comes with different ideas. So maybe their self-confidence is higher, and so they're better able to communicate with their peers. They also, along those lines, have higher communication skills, and so they're able to build relationships with other people more easily and more successfully. Whereas those children who may have some stress affect problems, so such as depression or low social skills, they may not be able to form those interpersonal relationships as well or as easily as the contrary.
That is terrific. Thank you so much for that.
Sure.
And it's so important for us to think about both sides of the decline's functioning. I'd like to turn my attention now to Hannah. Now, you studied about intimate partner violence among adolescents, which again, as I said, this session is focusing on young people and children. And I thought it was really fascinating that you found these gender differences between, on the dimensions of intimate partner violence when it comes to, males perceiving it as joking, whereas females tend to perceive it as, a denigrating behavior that's, closely related to anger. So what do you believe accounts for these gender differences?
So that question is a little bit outside of the scope of kind of what we were looking at.
Absolutely, yes, because I'm actually trying to challenge you. I'm assuming that everyone will read your poster and listen to it. So just based on your studies, I'm challenging you to kind of make some extrapolation beyond.
Yeah, so there could be a few different things. It could be kind of the way that male and female adolescents are kind of socialized in terms of, the types of play, even kind of earlier on, younger boys are typically characterized as playful in terms of like roughhousing and things like that. So it might be more of, kind of the general way that children are socialized to play based off of their gender. Another potential possibility may be kind of developmentally, there's some research suggests that kind of, even though the adolescents might be the same age, that female adolescents kind of mature and develop slightly, at a slightly faster rate than males. So those are kind of two reasons that I can kind of think of off the top of my head. But yeah, we were just kind of, this type of differences weren't really even examined prior to the study in terms of kind of the different categorizations. So, the why is still, pretty up in the air.
Maybe that'll be your next study. Thank you so much for that explanation. I'd like to acknowledge that Dr. Parente is in the room, and I will be coming to you shortly with a question about your contributions. But for now, I'd like to go to Kimberly. So Kimberly, welcome. And I know that you and Erica, your study was about juvenile interrogation law for psychologists. And given everything that's been happening around the country, I think it's pretty timely topic that you had reviewed a number of cases and you looked at the most visible one, I think recently, is the Central Park Five and what happened with that group of young men. In your study, you talked about the vulnerability of suspects and you talked about the parental presence and whether or not that really does isolate young people from being inappropriately interrogated. And, one of the cautions that you give is that child adolescent developmental stage and psychological assessment skills can really help psychologists in being expert witness and provide expert testimony in cases like this. So again, similar to all the other posters, presenters that I've questioned, I'd like for you to expand on this. I know it was not exactly what you studied, but I'm interested in, given what you've studied and what you found and that you've seen the vulnerabilities of young people who are facing the juvenile justice system, could you expand a little bit on how psychologists can better represent these young people?
Sure. So basically, like you had mentioned, this area is really growing. And even though it's growing in the field of forensic psychology as a whole, the great thing is it's also growing in the public itself with these shows, like you mentioned, about Central Park Five and also about Brendan Dassey, which we mentioned. So what we really were looking for in this is how can we help the forensic psychology community better suit themselves to look out for these type of factors that are determined in incriminating whether they should or should not admit incriminating statements given from juveniles. So we really wanted to cite basically these factors, not only to help forensic psychologists, but the legal field as a whole. What vulnerabilities should we be looking for in juveniles? They are more immature, and research has shown that they are more susceptible to factors such as when they're interrogated, how police are interrogating them, they may not understand the same way that an adult would. They don't know how to waive their Miranda rights as correctly or as adequately and knowingly as an adult may. So bringing attention to those factors may be able to create a distinction between how adults are interrogated versus juveniles. And then hopefully as a whole, that would bring attention to what we can do better for juveniles.
Thank you so much. Erica, did you want to add anything to that?
No, to be honest, she covered it all. There's just so many different, as she said, factors that play a role. And when you're looking at adult interrogations, you don't realize how susceptible juveniles are. Something as simple as, the Miranda rights. They might feel that inclined to answer a question when really they don't have to, but it's because they're in the same situation where they feel like they might need to answer in order to go home. Things like that. Adults fall prey to that. So imagine juveniles, 12-year-old, 13-year-old, they don't understand. And we've been taught as we get older to, listen to adults, be obedient. So they just really don't understand. And that makes them very vulnerable and susceptible to these type of situations.
Okay, thank you so much. And Dr. Parente, welcome again. And your study, you looked at a projective drawing technique, and it's really a good source of rich clinical material and advances the human figure drawing technique and reflects sort of a representation of the self. And I really enjoyed reading your poster and hearing your presentation. And as I said before, this session is focusing on children, and we can see that some of the presentations are looking also at assessment of children. And so my question for you is, how do you believe these drawings represent the internal, the inner and outer presentations, or do you believe they're more representative of unconscious dissociative processes? You're on mute, I'm sorry.
How's that?
Yes, perfect.
Okay. I just want to say what a wonderful group of posters. I was really fascinated by the wonderful and meaningful work you young psychologists to be are doing. And it was just great to be part of your group. So my multiple self-state drawing technique, it differs from standard projective technique, which is, has kind of been debunked by this time, which is the idea of scoring and normative sample comparisons and so on. So I have come to really value the richness of what children in representing themselves tell me about themselves in a safe way. Obviously, this is a clinical tool. It's phenomenological rather than evidence-based. And my data is from my own years of experience of trying this. But if anybody wants to do a research project, I'm all for it, using it. So what I'm doing with the multiple self-state drawing technique is taking a look at the meaning of self from a neurobiological perspective. So what we used to feel as self, and I did a zillion human figure drawings over the years, self is now understood to be much more complex than a unitary figure. And in working with kids, kind of in the trenches, day after day, week after week, I would see multi-facets of a child's personality. So what is the self? The happy child who walks in, who feels great because he or she did great on the basketball game that day, or the kid that walks in and, shamefully admits that he or she is cutting? What self?
Can I just kind of ask a little bit, if you can speak to, so as you're describing these different self-states, does your technique tap into sort of the more unconscious or dissociated self? Like, are you able to use your technique to make that kind of assessment as well?
Well, it's a clinical assessment.
Or is it
it's really an opportunity to be both a therapeutic approach and a clinical assessment, rather than an evidence-based assessment, or rather than a scientifically normative assessment. So it's about having the child think about their state of emotional regulation versus their state of emotional dysregulation, which is very often the reason why they're coming for treatment. Yeah. And so I have the child talk about their thoughts, their feelings, and emotions in each of their different self states. So whether that pulls for unconscious or non-conscious, whether it's frankly dissociated or just shame-based and kind of out of sight until we talk about it, it depends on the child who is present in front of me. Okay. So I'm not labeling things as conscious or unconscious.
Got it. That's so helpful. And the only reason why I personally asked about that is because I'm doing some work with mentalization, and sometimes this seems like it would be a good technique to use. So I want to get to some of the questions that are coming up in the chat. We have from Bennett in regard to the juvenile forensic psych research done by Mrs. Young and Mrs. I'm sorry, Kimberly, how do I say that? Echevarria?
Echevarria.
Echevarria. Do you have any recommendations or amendments for policymakers, law enforcement, interrogation settings, and so on?
Okay, so as for basically, we want to obviously draw attention right away to both legal and forensic psychologists about these issues. And basically creating a distinction between juvenile suspects and adult suspects is the first step to doing that in order to even move on to policy making. So first, if you're interrogating a juvenile how you would an adult, you're not really accounting for the vulnerability and suggestibility of a juvenile. So once we create that distinction, which we're trying to do through our research, is that they are more vulnerable. They may need to be questioned differently or have a parent in the room in order for them to fully understand what's going on in the interrogation room. So once that distinction is made, like I had mentioned, then we can work on creating policy for that, interrogating them differently, or for example, interrogating maybe for a shorter amount of time, or not allowing their incriminating statements to be allowed if their parent wasn't in the room or a guardian. So these are basically, we can try to create a policy from that. How can we distinguish them and what is going to be better suited for the juveniles?
Okay, thank you so much.
Yeah,
So
thank you. I appreciate it.
Thank you so much. So I have a question, a general question now for everyone, all of the panelists here. And again, thank you so much for doing such important work. I'm wondering if you can reflect on just sort of the state of young people given COVID. I know this is not the studies that you did, but given from your unique lens that you're looking at, whether it's, you know, social functioning, the juvenile justice, issues around, you know, how do you assess clinically a child in the room, looking at intimate partner violence among young people. So when you take all of these issues together, given everything that's been happening with COVID-19 and with the social and racial reckoning that's happening across the US, how do you see these topics being important and relevant to help us understand what's going on or help a young person?
Unless anyone wants to go, I can go first. So, I mean, there's already been documented, as actually we saw on Friday, on the presentation on that night during the town hall, domestic violence or intimate partner violence has kind of increased significantly during COVID. And I don't know the exact statistics for adolescents. However, given that a big avenue in which adolescents, you know, perpetrate intimate partner violence, especially denigration and kind of controlling behaviors, is through means such as social media and texting and, you know, all sorts of kind of technological means, has become very, very prevalent, particularly in adolescents, given that, you know, adolescents are basically born with a phone in their hand. So I think that the issue, even if the individuals aren't having direct contact, kind of in person, such as in school or, you know, kind of going out to the mall or anything like that, I think the issue is still very prevalent, given that the means that people are using for communication now are also means in which they've been using to perpetrate coercive behaviors, even prior to COVID.
Yeah, thank you so much. Leah, how about you?
So kind of in terms of the topic that we researched, I've heard mixed sides of the, you know, the virtual learning and kind of what kids are going through right now in the COVID times. And I've heard on one side that the children that used to not participate in class and not really interact with their peers they're actually thriving in a virtual context, whereas, you know, some people who kind of more enjoy the social interaction, you know, they're having a harder time adjusting because they're not able to see their friends in school anymore. They're not able to use their social knowledge as much as they used to be when they were in person. So I think this the project that we did would be actually very interesting to do again now, getting new measures now during the virtual learning, the virtual age, kind of to see are kids now more socially stressed, or are they less socially stressed now that they're kind of not in as many social situations as usual.
Okay. Kimberly and Erica, real quick, and then we'll let Dr. Parente have the last word.
Okay, I guess I'll go first. So when I really think of COVID and like basically now our age of technology and everything, and I agree with what Leah was saying that for some it's great and for some it's not. But I definitely take a look at the students that maybe don't have such a great home life, or they need that extra encouragement from other teachers and their peers. And they have a place to go that's almost like a safe space where they can learn. And at home, there's so many distractions, and oftentimes they need that extra push. And for some students, it's even hard to come home and just do homework, let alone have to learn a whole lesson. So that's really the aspect that I think of when I think of it.
Okay, and Dr. Parente, there are a number of questions for you. I'm going to give you like 2 minutes to respond. But
Okay.
another question in addition to Mark's question is, I'm curious if you're continuing to use multiple self-state technique even while you're working virtually. And if so, can you tell us more about that?
Yeah, thanks, Mark. You know, many of the kids that I work with, I have already had past experience with them. Sometimes I've been working with kids out in my backyard, and I will do the presentations then. In terms of starting with a new child into my practice with this technique, I have found it helpful to have them describe their various self states. You know, the hurting place or the jubilant place. Part of this technique is to remind people and to remind young people that they are more than their self states. So like all of us, I mean, they're a pained self state. They're more than their pained self states. So for all of us, I think we could use a reminder that, oh yeah, there are other times and other happy events and other places in which we can feel a sense of well-being. So sometimes I will ask children just to remind them of what their life was like pre-COVID, and also to have them find a sense of well-being, even though we're all going through this together. So yes, Mark, I do use it.
And thank you. What a beautiful, encouraging note for us to all end on. Appreciate your participation and all the best with your studies and your future research ventures. And I want to acknowledge Dr. Matthew Johnson on the call. So thank you so much for joining. Have a good day, everyone.
Thank you. Thanks for
Thank
the
you.
opportunity.
Thank you.
Thank
You
you.
too.
Thanks.
Bye, everybody.